Applying state and regulatory policies in the OR. When radiologic technologists enter the operating room to provide X-ray guidance for surgical procedures, there are many hats to be worn. In this presentation, I'll attempt to outline some basic responsibilities expected. You are the advocate for radiation protection in the operating room. This will actually begin prior to ever stepping foot in the operating room. You need to ensure the surgeon or X-ray supervisor in the room has a current fluoroscopic supervisor operator permit. I've had to initiate some tough conversations with physicians who want fluoroscopic guidance for their surgical procedures, but don't have this. As an alternative, they can either find someone with a supervisor operator permit to accompany them into the procedure, or they can order plain X-rays, but they cannot use fluoroscopy unless they possess this in the state of California. Most hospitals will keep a roster of current licenses, or you can look these up on the California Radiation Health Branch website in our state. While you may arrive into the surgical suite to set up your C-arm after the surgery has begun, you're ultimately responsible for a few things before you can energize the X-ray beam. You should always properly identify the patient and the surgery being performed, especially if you're not present for the procedural timeout. You'll need patient demographics to enter into the C-arm, and the equipment may take a couple of minutes to warm up. So I usually attempt to do this right after I've plugged everything in and pressed the power button. The tricky part is arriving after the procedure is underway, and the patient's wristband may be inaccessible due to the sterile field. So check with the surgical nurse. In addition, before you expose the patient to radiation, as well as anyone in the room, you'll need to make sure everyone has lead shielding. This can be done by simply asking out loud if everyone has lead shielding on prior to making your exposure. But make sure you get acknowledgement from everyone. If someone doesn't respond, make sure to call them out and let them know you're about to begin X-rays, and don't make any assumptions. Just as you are responsible for putting a 6-foot distance between the primary beam and anyone else during routine portable X-rays, this is also your responsibility. If no lead aprons are available, you may have to wait for them to exit the room, or sometimes they'll have rolling transparent lead equivalent shielding within the OR suite that they can get behind. Just be prepared to find extra aprons for staff and be willing to help them fasten up their surgical gowns over aprons if you're in the room prior to opening. It is also your responsibility to announce every 5 minutes of fluoro beam on time. Yes, this might get annoying, but it is a mandatory requirement. Make sure you're keeping the cumulative beam on time recorded and documented in your procedural notes, as well as any other indicators of radiation exposure to the patient available to you. Radiation-based exam dose is now a legal requirement for X-ray producing modalities in medical imaging.